Streaming now from KRON 4, the Bay Area's local news station.
And thank you for joining us here on KRONON. I'm Terisa Estacio. Bay Area doctors are starting to use monoclonal antibodies in the fight against COVID-19. These lab vaccines could help treat moderate symptoms of COVID-19. Dr. Singh is the chief of the Infectious Diseases Division at Stanford University, and he joins us now to talk more about this treatment. Welcome, doctor, and thanks for joining us.
My pleasure. Thank you for asking me.
And so kind of break it down for us. I mean, it is science, it's fast-moving science, and so explain to us what is really beneficial about using this kind of technique to battle COVID-19.
Yeah, great question. So I think I want to say, as fast-moving as science has been, we've actually had this technology effective against COVID for almost a year now. So I want people to know that this is a safe, effective medication and really should be strongly considered. The way that these medications work is that they basically bind to the virus. So the virus can't attach to the cell in the human body and can't go inside the cell. And if the virus can't go in, it can't damage the cell, it can't hurt the host. So this is really at the very first step. So it basically stops the virus from going into the cell and causing disease.
So does that mean that the disease has already gone in with the spike protein into the body and it's attacking the cells? And so this, therefore, is kind of a preventative measure, kind of like a Band-Aid separating the two?
Yeah, kind of like a Band-Aid. The antibodies actually bind to the spike protein that you mentioned, and so it prevents the spike protein from attaching to the cell and going in. So by the time somebody has symptoms and they get tested, they already have had some virus in their body by definition. They already have had some virus enter the cells and cause some damage and some symptoms. But what these antibodies do is they prevent the symptoms from getting worse. And the main goal of the antibodies is, if given early in disease to people who are high risk, they prevent hospitalization, emergency room visits, and death. So they're really a great, safe, effective medication to consider.
What kind of comes to mind, making this simple, is that like it's a magic eraser, like it's kind of erasing the worst part of the disease and trying to beef up, for lack of a better word, the immune system with the antibodies in there, right?
That's exactly right. And so these medications have been shown to reduce hospitalization and death. They also reduce the amount of virus in the nose. They limit the amount of transmission you can have to the household contact or next person. So they're really effective in both inhibiting transmission of disease as well as limiting the extent of disease.
So that brings up another question in regards to, like, for example, if there's two people inside the home, one person is sick, would the other person get monoclonal antibodies just as a preventative measure, or would it only be for the person that tested positive, like through a PCR test?
Right. So the landscape is changing rapidly. We used to have a monoclonal antibody that we could give both for treatment as well as for post-exposure prophylaxis. So what you talked about, a household contact, was very high risk. We had a medication that was effective for that. However, the big change in the latest last month or so is the arrival of the Omicron variant. This variant is resistant to many different monoclonal antibodies. However, there is still good news. There are two monoclonal antibodies, one that has been tested for treatment, so treatment of a sick person, and one that has been tested for helping people who are very, very high risk and those who cannot respond to vaccination. So highly immunosuppressed transplant, bone marrow transplant patients such as that. So we do still have good monoclonal antibodies, both for treatment as well as for preventing disease in people who are very high risk.
And so, and Dr. Singh, is this something that continues to develop as we get more variants? I was talking to Dr. Peter Ching Hung about the French IHU that's now out there. But going back to Omicron, we now think we understand, based on the data that I've seen out there, that it doesn't go into the lung protein. So that's kind of a different kind of issue. So bottom line, this is a fast-moving disease, and we're constantly trying to develop new antibodies and new ways to approach it and attack it, right?
That's right. And so what we've seen is the virus so far has been ahead of us, almost at every turn. Omicron has shown us that Many of the monoclonals that we had relied on for the last year are not effective, but thankfully we have, two that still are effective. And these companies are working hard to come up with new monoclonals and new therapies. So, so I think there's always going to be something that's going to be available, but we do have to keep up with how the virus is changing. We have to then adapt our ways of treating the virus as well.
What's next as we continue to fight SARS-CoV-2? I mean, what do we do next to get ahead? I mean, obviously we have the vaccines. Obviously we have the booster. We should wear a surgical mask as opposed to a cloth mask. Now what?
Right. So I think we have the vaccine and we have the booster. And I think we're so lucky in the Bay Area that a lot of people and the majority of individuals are vaccinated. But I still think there's a big push that we could make to get everybody who's eligible for a booster to get boosted. I really think with Omicron, with how infectious it is, with our kids going back to school, that's going to be really important to keep people safe. The other next thing is that there are 2 new oral medications that have just been given emergency use authorization approval by the FDA. These are, again, for people who have mild or moderate disease or high risk for progression to severe disease, but they're not in the hospital yet. They're in the outpatient setting. And so these medications have just been given approval. They're going to be in limited supply, but again, I think it's a nice addition to the arsenal for treating the highest risk patients.
Have you seen any data as far as what will be next for boosters for the younger? I mean, we just got approval for Pfizer for that other age bracket, so now we're going to go down to the 5 to 12. Is there any data that you've seen on that?
I have not seen the data on that, and I believe that the advisory committee is sort of considering that issue as well. I think the other thing we've seen for the boosters is a reduction in the amount of time you have to wait, so you can get a booster after 5 months instead of 6. And again, the idea here is that these vaccines are safe and effective, and it's sort of just about keeping us ahead of the virus and making sure that even if we end up maybe getting sick because the virus is so infectious that we don't get critically ill. Our hospitals are very busy, our emergency rooms are very busy, and so we really just need to keep as many people out of the hospital as we can.
Is there anything else you think is important for people to kind of get their head wrapped around as we are kind of staring down that March 2020 when we all had to shelter in place? I think that, on one hand, I want to be respectful and mindful about the fact that people are, full of fatigue. What would you say at this point in this fight?
Yeah, so I think healthcare workers are tired. I think we've been, battling this for 2 years, but I also think the community is tired. We're tired of not seeing our friends, our colleagues, of not being able to do things. What I would say is I am pretty careful. I only meet friends outdoors. I really always wear a surgical mask. I haven't done sort of higher risk things. It is a very personal decision, and I always have some testing that I have at home in case somebody gets symptomatic. So part of this at this point, I feel like I know if I get sick, I won't end up in the hospital. I'm vaccinated and boosted, but I also want to make sure that I don't see an elderly patient or an elderly friend and get them ill, that I don't, I'm not around an immunosuppressed person who maybe doesn't have the benefit of the vaccine because they're not going to respond to the vaccine. So even more than 2 years ago, I think it really is now about behaving in a way that's good for the community. Most of us who are vaccinated are going to be fine, right? But I think it is really about making sure the hospitals stay open, that the staff are able to go to work, that we're able to take care of everything else in addition to COVID. And then, of course, get boosted, get boosted, test yourself or to get tested if you have an antigen test at home, if you have any symptoms, and just be cognizant of just how contagious this really is this year.
Very true. Well, thank you very much, Dr. Singh, for coming with us and giving us kind of that update.
My pleasure. Thank you so much.
Thank you.